Good late morning, early afternoon, or maybe early morning, or maybe late afternoon for wherever you are. Thank you so much for being here. Thank you so much for joining us today. My name is Rachel Ramirez. I use she, her pronouns, and I'm with the Ohio Domestic Violence Network, the statewide coalition on domestic violence in Ohio with 76 member programs. I will have the opportunity to talk a little bit about my work later on this afternoon, so stay tuned if you want to for fun 3:30 session later on today. But I am really thrilled to have the opportunity to talk with to lead this, no, not to lead, to help facilitate this survivor focused session with a good friend and partner in crime of mine, Paula Walters, who you will also see on the screen. Paula and I both live in Ohio. We have had the opportunity to do lots of different training together, both within Ohio and around the country. And really appreciate, I think, one of the things that is most important for me, being I'm here kind of representing the direct service, the practice-based, the clinical, however we call that in our world, side of things, is really making sure that we are focused on and really centering survivor voices. So I am actually going to, and it's okay, I'm going to share my screen just very quickly. And we're going to have the opportunity to try as we get started, Paula, and we'll get going in just a sec. I'm going to see if this is going to let me do this, but I know that we all have been sitting and we've heard a lot of great information today, but I'm going to ask you, we're going to try to do something a little bit interactive right now. And I'm going to pull up, I don't know if any of you have ever had the opportunity to do a Menti, but I'm going to pull up and publish this. And I think hopefully you all can see this. I did this for the first time yesterday. I do a lot of training, so I'm very excited about this. And I did it well yesterday, so I think I am 1 for 1 so far in using these. But please, will you let me know if you can see something that says, I have listened to a survivor talk about head, neck, and facial violence. The reason that, and there are 2 options to join at the top. You can see a code that says menti.com. You just go and you use that code. If you have a phone, a QR code, you can click on that QR code. But I think that one of the things that I really wanted to, and the reason it says H and F is because I'm not really good at formatting this yet, and I couldn't figure out how to not cover up the QR code. But I wanted to just start with, first of all, seeing where people's experiences are and really highlight the significant importance of listening to people's stories. And we really need to, there's so much that we don't understand about this intersection of brain injury from violence. There's so much that we are learning, and we've heard from many people who are learning a lot of really important and really new things. But one of the things that I think is also needs to be at the center of this work is experiences, diverse experiences from survivors. So I really appreciate this being a significant part of this conference this year. I will continue to leave this up for just a couple more minutes for anyone else who wants to participate. And it seems like we have people, and this is kind of why I'm so excited that Paula's here. We have people that have spent many times and have listened to survivors talk about violence over and over. We have people who have never done that. We have people who don't work directly with survivors. So Paula, I wonder if you could just kind of get us started by introducing yourself and sharing a little bit about your experience and your background and your journey with brain injury. And I'll leave this up for just another minute, but then I'll stop the share, and then we will just be able to see Paula.
Hello, everyone. My name is Paula Walters. So I am a paramedic here in Ohio. I have been a paramedic for over 20 years. I've been in fire and EMS altogether about 24 years. And back in 2006, I had a near fatal strangulation with a domestic violence with a partner that I was living with. He was an officer. And I actually, at that time, was working full-time on the fire department as a paramedic, but also working in a level 1 trauma center. So the highest level of care for trauma as a paramedic in the ER. And that after an incident where I did have multiple hits to the head on that night of June 25th, and I also had vividly remember his hands around my neck and kind of having that moment of like, I'm about to die. And then that's kind of one of the last things that I remember. Thank goodness for nosy neighbors who, I'm alive thanks to a nosy neighbor. But I ended up being seen in that same trauma center that I worked in. And, you would think that the strangulation part, the domestic violence night was going to be probably the rock bottom. And to be honest, I think that that was probably just the very start of the hill going down towards rock bottom. I didn't have any medical problems up to that. And from 2006 to realistically 2017, I continued to get sick. That night in the ER, I was evaluated by a forensic nurse, had petechiae. I mean, I had multiple points of, now we understand strangulation a little bit better, that it was clear and evident that I had that. One of the doctors has told me since that I actually had venous congestion in my neck, but I was diagnosed with contusions. I was discharged that night with paperwork that said, just, discontinue this relationship. Matter of fact, the ER doctor that I worked with said to me, what did you do to make him so mad? He's such a nice guy. But forward over the next, from 2006 to 2017, I started having multiple problems with my blood pressure, my heart rate. I had vertigo. I started having a lot of autoimmune problems. So I got diagnosed with idiopathic anaphylaxis. I got eczema, started having, mastocytosis, to the point where late in 2018, 17, 18, I actually got diagnosed with MS, and they said it was a very aggressive form of MS, to the point of, at the beginning of 2019, I was told that I would probably not see 50. My paramedic was taken from me. I was not able to function as a paramedic. And my driving privileges got taken from me. And so it was this 2006 to 2019, here I am, a single female who I've just lost driving, just lost my job, the only job I knew how to do. And got a lot of mental health diagnosis in that time. And I was at rock bottom. I really suffered with suicide, made an attempt. And there was this part of me deep inside of me that didn't believe that I had this MS, that I had all these medical problems. It was like I could function so well. And then I would have these days where I could barely walk straight and I felt completely drunk on a boat. And that was just very difficult for me to understand as a healthcare provider because nothing was adding up. There was no rhyme or reason to what was happening when. And so I started kind of looking. I ended up having Bill Smock come into my life in a very odd way. And in talking to him, he actually talked to my family practice doctor who said, I think that the strangulation piece from 2006 has a big part of it. So in 2017, when I met Dr. Smock, he had talked to my family practice doctor. I did have in 2017 a MRI that specifically mentioned previous brain injury. And yet the neurologist that I saw from 2017 to 2019 kept ordering tests and said to me multiple times, you cannot have symptoms continuing to show up now from something that happened in 2006. So he would not even hear of that. So I ended up reaching out to research online, and I found a woman who, by the name of Amy Zellmer, who had this TBI community, and I actually reached out to her because she had a lot of the same symptoms as me. And I found a functional neurologist in Minneapolis, Minnesota, and I called them and I just said, hey, here's what happened to me. Is there any chance that I have a concussion, that I have a brain injury? I went out there the second week of June of 2019 and came back a completely different person. I was back to work a couple of short weeks after that, functioning normally, feeling 100% better. People like Rachel, who were in my life, people who saw me before and after, like shortly between those times, could see that I was a different person. I mean, I went out there not being able to just walk a straight line and kind of move my head without almost falling, and came back. And I mean, I was passing one of the final things that I did out there was being in the gyro stem. And so it just kind of turns you up and down. And I did that while taking a red light, laser light, hitting targets and being able to count back from 100 by sevens while I was being moved. I mean, I in 1 week, 14 hours of treatment, and I was completely changed. So if that makes, I guess that's to sum it up. Is that good, Rachel?
Yeah, Paula, I know that there's so much. Paula and I can spend days and have spent days talking about this in other places. And I also would encourage, if anybody has any, we're trying to put some information in the chat box. If anybody has a question for Paula, please feel free to share that either in the chat box or the Q&A. I'm trying to make sure I'm checking all of the different places. But would you talk just a little bit about the impact that knowing about, we talk a lot, that first question that I asked about having discussions about brain injury and knowing about that potentially being contributing to some of your health problems, contributing to some of your, we talk a lot about just life just is very, very hard when people have survived, not only are living with the impact of brain injury, but also the impact of the trauma in which domestic violence causes. So could you talk a little bit about just kind of what that has meant to you, and how having brain injury be a part of your puzzle, how that has kind of changed things?
Yeah. So, as a paramedic, we respond to strokes, to, concussions, head injuries from falls. And like, I used to think that neuro, especially working in the trauma center, like neuro was one of my things, like cardiac and neuro were huge to me. And I had no idea the impact of like all the things that neuro can actually impact. So I think that some of the biggest aha moments for me was understanding neurofatigue. So, um, and I think that if people don't have, nobody had that conversation with me about, these emotional problems. Like I kept getting diagnosed, like they kept saying, you've got depression, you've got anxiety, you got OCD, you have all of these things. And they were putting me on medicine after medicine after medicine. However, nobody, even with that MRI that said that there's that brain injury piece, nobody talked about the neurofatigue. Now I know that like I can't have too much stress. I have to get sleep. I have to prioritize sleep. If anyone that has any kids or been around kids, like when toddlers get extremely tired, they get very, angry, or they get, where they throw those fits. I'm essentially the same way. Not having enough sleep makes me more susceptible to anger outburst, like overreactive crying, like crying about anything and everything. And so I have to be very aware of the neuro impacts. Then there's also this piece of like, I have to be, so part of my story is understanding that my blood-brain barrier was broke in that incident, which makes me more susceptible to chemicals getting into my bloodstream and impacting my brain. So I have to understand that I have to be very careful about the things that I eat, and the chemicals that I use, because I feel those, like if I have gluten and dairy. So I don't do gluten and dairy, specifically the brain gut alignment and that blood brain barrier being broken. If I have gluten or dairy, I feel like I start getting increased in brain fog. Then I start seeing neural symptoms. So I have mostly right side brain injury when I am extremely tired, or I'm impacted by like a gluten and dairy, or if I'm around someone who smokes cigarettes. Sometimes that impacts me. I'm very sensitive. I'll start having neuro implications. So my left leg or my left hand, I'll start being clumsy with my left hand. So it's like the weakness that comes, which is one of the symptoms that I had that led them to think that I had the MS. So understanding the why, which is one of the big things that my functional neurologist has worked with me, is he didn't just tell me, here's what you have. He told me why and how I fix it. So understanding like the very complex part of the brain, and I can pretty much, if I have symptoms day to day, I can tell you exactly why. Plus, I know how to fix it. Like I'm in this room that I'm in. This is just my little part that I do Zoom meetings on, but the whole rest of this room is covered with neuro stuff for me to exercise every single day.
Thank you, Paula. I think one of the things that I hear from you, and just coming back from my experience working with domestic violence survivors and even working in a domestic violence program setting, it's talking about neural fatigue and the important role of having both professionals and advocates and people, and even I think with researchers who are working with survivors, understand that piece and it not be kind of like, I mean, I remember working with survivors in shelter who would come in and they just sleep and sleep and sleep. And we know trauma can have an impact on sleep. I think that that's one of the pieces we don't want to lose, is understanding how the psychological impact on trauma impacts the brain, laying that on top of the neurological trauma that can result from head injuries. But it did get to a point where we're like, sister's got to get some stuff going. We've got to get moving and we've got to find housing and we've got to go get a protection order. And her kids are running around all the time and she's got to take care of those kids. So kind of, and I think about it as very, like, I think that one of the things that I've learned that has been so powerful for survivors who learn a little bit about this, and also professionals who learn a little bit about this, is we see some of these behaviors in a different light, right? And it's not like Paula just needs to get her act together because we've got things to do. I wonder if there's other, I know that we did have a question from Karen about, she wanted to know, met a woman last week who's dealing with very similar ongoing issues and very similar disbelief and lack of support from medical professionals and others. So I think that that's something that Paul and I actually were on a call an hour ago as we were planning for this, and just Paula's talking about some of her struggles with kind of the mainstream medical system, and also, and particularly I think here in the United States, there's so much specialization, and like this type of doctor works with this little thing and that type of doctor works with this little thing, and just all of the challenges related to access. I wanted to clarify real quick with Karen's questions, Paula, that she wanted to know, could you state again which modality and clinicians it was that helped you recover so dramatically? It was functional neurology. Is that correct?
Yeah. Yeah. So functional neurologist. Yep.
Mm-hmm.
He's a chiropractor with the Keurig method. So they're chiropractors with a very specific training in neurology.
Well, and
I'll tell you,
oh, go ahead, Paula.
I'll tell you, they have really helped me. So not only do they understand that, but they understand the very complex part of trauma and the way the body stores. So they have helped me kind of rewire like my dopamine and all the impacts of trauma, and being able to kind of get those levels back down, because having that night, it didn't just start. I think that getting out of the medical community, that is the hardest relationship I think I've had to leave, is breaking free from the gaslighting and that type of stuff, from the just being told that I'm crazy, being told that like I can't think for myself, I'm not a doctor. I actually had my neurologist tell me, you're just a paramedic, don't tell me how the diagnosis goes. And it's like, I'm feeling it, I'm trying to tell, so it's very much, it was just felt like being in an abusive relationship again.
I know Carrie asked, how did you feel most seen and supported at this time by clinicians or other helpful helpers, but also by your support network?
My support network was very, I didn't have a lot really. And I think that that's a piece, I'm a paramedic. I shouldn't be feeling sick. I am, and I know that this is horrible to say, but like a lot of times people that frequent the hospitals and the ERs get seen as frequent flyers. And I became that person. And that was very hard for me because people that I work with would always say, you're very sick, you're sick all the time. There is that component of my family didn't support it because, they saw me the same way as like being sick, but there were some of the medical community, like the forensic nurse that saw me, and there were some people who came alongside me and just told me that they believed me, but I very, very much felt alone. I don't think it was until I got into Amy's TBI survivor community that I felt like I had a place where I belong. And although there wasn't very many people in there as domestic violence survivors, that intersection is not talked about very much. And even to this day, there's not a lot of places where you have TBI and DV, but the very few people that I have, I have my friend Carrie, I have, both of my doctors are very supportive, and I've created kind of my own community because there isn't that place. So I guess I would say like that's one of the things that I really think as a survivor that we really need to do is create more places for that intersection, the people that are dealing with that very complicated intersection.
Yeah, and I think that that's true, Paula. We spend a lot of time I work with, again, domestic violence programs and do a lot of training around this, really around the country. And just really recognizing that even in a lot of the people who work in the brain injury space haven't really fully considered what the domestic violence piece means. And a lot of people who work in the domestic violence space haven't fully considered or aren't fully knowledgeable about what the brain injury piece means, which is one of the things that's so exciting to be able to bring these two worlds together in a conference like this. Could I ask, and I know that we have, so I have one other thing. What kind of support do you wish you had received from friends and family? What do you wish you would have received from friends and family? What do you wish that you would have received from professionals?
I think they would honestly just being able to be there and not criticize me. Everybody wanted to say like, oh, people get concussions all the time. It's not that big of a deal. I mean, even today, I still hear that. Like, women get beat up all the time. So like, why are you so stuck? And that some of that's because I am in this rural fire and EMS community where we have to stuff our feelings. Like we don't get that part where you get to have a moment, and I actually just in the last week joined a critical incident debriefing team because we need to talk more about our feelings. But like people need to stop telling me how to feel, or that it's been 7 years, why are you still having problems with it, and just those things. Like it's very, very hard to try to focus on yourself when you have to be able to defend yourself all the time. And so I've just gotten to where I just cut people out, I try to explain what I'm going through. And if people don't understand that and support that, then I let them go now. I am very, very tight about my boundaries because I have to work very hard daily, and I don't have to work. I'm not going to use that time or energy to defend people who do not understand, because I can't make them understand. And I've learned that I have to stop trying to, because that's kind of like the coping mechanism from being a victim and a survivor, is trying to make people accept me. I don't have to have them accept me.
Paula, I know we just have a couple more minutes and we could listen to you talk forever. I did put Paula's email address in there. Someone has asked for your email, but we do have a couple of questions about your chance to get more information on exercises you have in your office, or if you could just talk briefly about what are some of the exercises you do to minimize your symptoms. We have that. Maybe just, I don't know if you have one that you could, I don't know how, I know that we've demonstrated some of them, but if you could maybe just talk about one or two of those.
So I will say, I do a lot, like if you're on social media, Facebook, Instagram, TikTok, YouTube, I'm under the Courageous Survivor. So you can go under the Courageous Survivor or type in my name, Paula D. Walters. I do a lot of my videos. I actually just recently sustained a concussion again at work. And I actually did some videos of rehabbing at home, what that looks like. So if you go to thecourageoussurvivor.com, Rachel, I don't know if you can type that in, but that's my website. It links to all of my social medias and my stories there. But you can see a lot of the videos. I do them in the office. I do a lot of dots. So a lot of the things that I do are with my eyes. So real short, like there's where you are in space, your eyes tracking, and then kind of like your inner ear, so your vestibular system. All three of mine were messed up. And but my eyes are the biggest thing, which gives me a lot of my symptoms, nausea, dizzy. So I don't know if I can do this real quick. I will just show you. This wall has these dots right here, and I work on these dots. So it's just as simple as sitting down and looking at them and just tracking and moving my head while I'm keeping my eyes. So they're super simple things. And I rehabbed my concussion at home in 7 days, and I sustained a pretty bad one. But I do those things every day to keep me normal, as what people would say, so that I can, keep going out there and trying to be a voice for other survivors. But there's tons of stuff on there of me doing videos. Some of them are pretty funny because you'll see me falling off when I'm having bad days. But you can see the difference between bad days and good days. And I have them, and that's okay. I got to give myself permission for those. And I think that as survivors, we forget that it's okay to have bad days.
Paula, as we have to wrap up, could you just give, what is your piece of advice for, I would like to give one very quick piece of advice for professional, and we also know that we have professionals and survivors that are a part of this conference. What is one piece of advice that you would like professionals to take with them around their desire to really work helpfully and effectively with survivors impacted by brain injury? And what would you say to the survivors who we're so glad and so grateful to have you on this, join us this conference with us?
So the survivor one is super easy, and that is to trust yourself. I know that we've all been conditioned to not trust ourselves. Trust yourself. Nobody knows your body better than you. So listen to that, stick up for yourself, and be a voice for yourself as far as like medical stuff and emotional stuff goes. So that's number one. And you have to fight for yourself. But to the professionals working with the survivors, we know ourselves. And so listen, and we can't articulate to you as well because we don't understand it. And as far as you guys go, you can't describe to us in 15 minutes the impacts of of a brain injury or anything. So how do you expect us to do that to you? So take the time to listen to what we're saying. And I think that, especially when somebody's so adamant, like I kept telling them over and over. And when your patients are telling you something's not right, and, just hear them, like let us feel heard. And I guess the other thing would be find different ways, like your body language and the things that you say stick with us. And remember that, because we don't trust very well the way it is. And when you come at us and you're saying, crossing your hands and being like, well, that's not the way it works. Those things, just listen. I guess just listen.
Thank you so much, Paula. Thank you, everybody who joined us. We really, really learned so much from you. It's my favorite thing to do is to ever be able to share space with you. So we appreciate you making space. We have the contact information. I'll try to make sure that we forward all of that information to Carrie too. But thank you all for being here, and look forward to continuing this day and continuing to talk to you all later.
Thank you.
Paula, I really cannot thank you enough. And I hope you see the positive feedback that you are getting in the chat and the gratefulness that everybody is. Your story from someone on the other side of doing research and nerd stuff, it helps. It makes us do better work. And I'm sure that many of our advocates and our clinicians and our professionals on here, because of what you've said, they will do their best to believe all the time. So thank you so much. We are so grateful to you.